privilege to welcome you all here today to the St. Martin Lions Club Signature Project, the Oral Hygiene and Dental Care Initiative Workshop. As, as President, thank you. As President of the St. Martin Lions Club, I stand here with immense pride and gratitude as we gather to shine a light on an issue that too often goes unnoticed: the importance of oral hygiene in our younger generation. My theme this year is Leave Your Mark, where lions roar, evolution soars. And this project is a perfect example of how we as lions, through service, can leave a lasting impact on our community. This workshop marks the completion of a week-long initiative, one that began on Monday, the 7th of April, and concluded on Friday, the 11th. During this time, we reached out approximately 50 students from the grades of 2nd grade and 3rd grade, representing 5 primary schools: Sister Regina Primary School, Reverend John A. Don's campus, St. Martin 7-Day Adventist School, Leonard Connor Primary School, and Asha Stevens Hillside Christian School. These students participated in a hands-on survey, they visited the dental clinics, and received free professional cleaning, all aimed at setting them on a path of a lifelong healthy practice. But we didn't do this alone. The initiative was made possible through the power of collaboration, the heart of what it means to be a lion. To our local dentists, dental professionals and clinics: Dental Clinic Marlon Halley, Bryden Dental Clinic, Dental Care Clinic, and the orthodontist Dr. Wissam El Haq, we thank you deeply for your expertise and compassion. Special thanks to the dentists who work directly with our children this week: Dr. Marlon Halley, Dr. Hilda and Dr. Cassandra Dowling. Your generosity, time, and care made this more than just a visit to the dentist. You made it a memorable, positive experience for every child. We are honored to have Dr. Haq to present with us today, and excited to hear your presentation. I also want to acknowledge Dr. Lynn Bryson, who, despite being unable to be present due to illness, graciously offered her support and time. We appreciate your willingness to serve. A heartfelt thank you to Motorol and Thrifty Car Rental for their generous donation of 2 vans which safely transported the students to and from the dental clinic. Your partnership was vital to making this a smooth and successful project. I also want to recognize our educators, the educators, school administrators whose support ensured that the students could participate in. To the parents, thank you for trusting us with your children. And to the children, you were the reason we started this, and your curiosity, your smile, your bravery are what made it worthwhile. To my fellow Lions, thank you for always being ready to serve. A special thank you goes out to our committee chairperson, Lion Eldred Louisa, for your dedication, coordination, and commitment in turning this vision into a reality. This is not just a project. It is a promise to our youth and a testament to what we can accomplish with service leads the way, when service leads the way. But today, as we officially welcome you to this workshop, I encourage you, children, parents, teachers, and community members, to take what you learn here and carry it forward. Oral health is
still not finished, but this gives you a good understanding of the situation. This is part of the survey. Again, more participants till now. The survey is still open for we will leave it for at least 2 more weeks for anyone that wants to do the survey can still do that. This gives you an indication of the group. Majority of the group was group 4, group 2. Pass through the presentation so that we can start with the workshop itself. This is the age bracket. Majority was between the age of 6, 7 and 8. This is very important to pay a little bit attention. We have asked, how long do you brush your teeth? We're seeing here that majority brush their teeth between 30 and 60 seconds and 1 and 2 minutes. This basically indicates that there is still a good indication that they know that brushing your teeth is very good. This is also very important to mention. Most that did a survey using fluoride dental toothpaste. This is, I will say, very alarming because it's very important to flush your teeth. The majority is saying that they never flush their teeth. This is for me the most shocking that I got from the survey. We are asking the question, how often do you go to the dentist? And 55% indicated that they never go to the dentist. And we also have seen that in the result of the assessment, testing by the dentist. This is some of the information I was only able to collect across the 2023 of the assessments that was done, carried out. We have a total of 50, but I managed to process 23 till now. You can see from the 23, 5 is in poor condition. We have 9 still not there. If you go now to the teeth condition, you can see that 7 is moderate decay, severe decay, a total of 5. And when we go to the dental health, this is where I find it very alarming because consequences for the future of the students. This is basically the best. We have checked about the plaque and tarsus buildup. We see that 10 is moderate, so the basically progressing. If you check the issue alignment, we have 5, 6, I think, severe misalignment. And this recommendation by the specialist dentist, we also got through the assessment that there is 14 from the 23, we already have 14 referrals, which I find is very high. These are some of the recommendations that we got through the assessment reports. I will not read them now. Eventually, at the end of the project, we will create a detailed report that we will share with government and also the schools. Having finished my presentation, I will want to invite Dr. Hilda to present. Okay, wait.
Oh, this is so fancy.
Oh, Melissa? Yeah. Oh, okay.
That's okay. One word.
Okay.
You leaving this here?
Um, Sorry, I made a mistake. Minister, my apology. We have you also to give a few words to the guest. So come on.
Thank you. Good morning, everybody. I will keep it short and sweet as I usually do. I was happy in any way to support this initiative because I do believe it's important. As someone who was made to go to the dentist when I was a kid, I'm thankful for it now, especially growing older and learning that dental health is not just about a nice smile. It impacts all factors of health in your body, your heart, and so many other areas. So looking forward to the workshop, and I'm happy in the future as well, as Dr. Hilda and I were just talking, to support in any way getting more awareness about dental care into the schools, because that amount not ever going to a dentist is very concerning to me. So looking forward to it, and thank you again for having me.
Thank you, Minister. Now, I want to invite Dr. Hilda to come to the podium.
Never had done it so fancy. And the click. Where I have to click? This one. Okay. Well, it's still morning. Thank you, Minister. Protocol has been set. Good morning. My name is Hilda Guevara. I have had the privilege to live in San Martin for the last 22 years. And I have had also the privilege to collaborate with Lions, I don't know how many times, to be honest, since the last 18 in Lions Healthcare Fair and so on. And I'm gonna change a little bit my introduction based in the information that we received starting. Yeah, what you saw, I think actually the reality on the island is a little bit worse. We have to worry a little bit more. Yeah, actually this is a month of preventive care and medicine, but unfortunately on the island, preventive medicine is medic, is doctors, is nurses, is not dental. Preventive medicine, it doesn't include dental care. People have to 100% dental care is private. And a situation I don't have to explain how difficult it is for middle class, and even I will say a little bit higher than middle class, to finish the end of the month. So it's a thing of a priority. If I don't have food, I don't need the teeth for. If I have to provide, I have to provide electricity, I have to provide education, I have to provide food. So we left behind dental care. And it's happening. School dental programs are being modified and delayed for the last maybe 10 years. But thanks God there is a new generation that is moving forward, and maybe in a short future we can have dental care included in SBB, and we can have school dental programs again moving on and giving awareness and some basic preventive dentist for our kids, that actually is the future and is actually the most important part. So I came here actually to give you some tips, real tips about dental care. I didn't know the presentation was going to be addressed to adults or to kids or a mix like it is now. So what I was thinking how to do is say, well, the best way maybe is to talk about realities, and this is not moving, okay, and talk about questions, the most common question that the people ask us, dentists or dental care takers, and also address a little bit why preventive care matters. For basic reason, like any health, like when you're taking care of your car, or when you're taking care of your house, or when you're taking care of yourself, first to put yourself in the things that are important in life. You can get a new car, you can get a new house, but you are not gonna get a new you. You don't have another you in the closet to change it, okay? So we have to take care of ourselves, and oral care is part of taking care of ourselves. You cannot be healthy without oral care. We cannot be healthy if something like this is happening, even if it doesn't hurt. Even if it's not hurting yet, we are not healthy. Besides that, it's also a way protect your incomes, because if we can take care of if we don't create the problems in the future, we don't have to pay for them. We don't have to pay to repair something. It's better to prevent. And in oral health, also prevention is very important. Even if you have a little hole, oral care is preventive dentistry to repair that hole when it's tiny instead of that become bigger, and it's better to repair it now before you need a root canal, and it's better to repair it, do the root canal before you need an implant, because if you don't have to do anything, you don't have to pay. But if you do a filling, then you have to pay $90. But if you do a root canal, it's $300. But if you do an implant, it's $2,600. So it's good for the pocket. So brush your teeth, taking care, going to the dentist is good for the pocket. It's good. It doesn't go? Okay. It's good to put money here to plan your vacation. So it's important to take care. It's important to take care of ourselves, and it's important also for our budget to take care of ourselves, and it's important, of course, for our body. So, as I told you, I put some questions together. That are the most common questions. So it's really important to go to the dentist to do checkups. Yes, it is. It is important, and how often we should go. Ideal should be at least for an adult, healthy adult, twice a year. For young kids, I will say in between 14 to 20, you can stretch if they have a very good health care and they take very good care and they floss and everything is okay, you can stretch it to once a year. But anyhow, ideal is twice a year if everything is okay. When we have a special condition like maybe high blood pressure, maybe aging, maybe the enamel a little bit weak, then your dentist or your dental care provider, dental hygienist, will guide you and recommend how often you should go, because this is very personal, okay? Like anything that has to be cared with us. So it depends on our condition, then we go. So I will say yes. How often I should go? Twice a year, in order to prevent gums disease, cavities, in order to save money, because then we don't have to take care of more complicated situation. And I want to show you here is because sometimes the teeth look perfect, but the problem, you are not gonna see, you don't have a hole, you don't have an inflammation, you don't have a gum that is bleeding, but something is happening. So with the regular checkups, then you can find those problems before it becomes a bigger problem, and it can be addressed when it's an incipient decay, an incipient cavity that is just affecting enamel, that is a lot cheaper and easier to address than when we have a big hole. So during the checkup also, depends on the situation, depends on the person. Sometimes they do X-ray, bite wing X-ray when we have like this. Every 2 years or every 3 years or even every 4 years, depends on the schedule that is personal for each patient, and then we can find the situation before it becomes a big problem. The other question that people ask, is brushing twice a day enough? In general, yes. Twice a day, a good brush of, where like they were saying, a good brush of around 2 minutes once a day is enough. Actually, it's not recommended to brush your mouth more than 3 times. It's not recommended to use abrasive things every day like baking soda. No. Twice a day, well done, is enough. That will, as we will see a little bit later, include not just your teeth, also take care of, rinse very well, do the flossing, and also don't forget to clean gently your tongue. This is basically how to brush that. You're gonna address that, no? How we have to brush. Basically, we learn to brush when we are like this, with baby teeth, around 2 years old. For the parents that are here, please supervise the brushing of the kids. Until when you have to supervise the brushing of the teeth of their kids, or until when you have to remind them that they have to brush, until they pay their own bills to their dentist, okay? When they go to college, you call them, did you brush? Yeah, well, until you are paying. Why? You have living in another generation. We used to have the TV in the living area. We have to be together, and then you take your shower, you brush, and you go to bed. This generation does everything in the bedroom, especially teenagers. They have their own PC, computer, laptop, whatever in their bedroom. And they snack in the bedroom and then fall asleep. So this is something that we have to include in their care. The situation changed in 2 matters. First, they don't have no more baby teeth that are easy to brush. And second, the dynamic change, and if you snack after the dinner, if you snack after the dinner brushing, then you have to brush again. Because the key is to brush exactly before you go to bed. In between the last brushing and going to bed, water. And water, not sparkling water, just water. That is the only thing that you can ensure that your mouth is gonna be, or the kids' mouths are gonna be clean for the 8 hours, that this production of saliva is gonna be less, and then the teeth are gonna be more exposed to the acid that the bacteria produce, because they don't eat teeth. They produce the saliva, the acid, as a consequence of their process of eating. Literally, they pee acid in your mouth. So we don't want that, okay? Especially for you kids. So we have to ensure that we brush properly before bedtime. That is the most important one, and rinse very well. The flossing, you can do it once a day, whenever you have more time, because the idea is to do the flossing properly without rush, ensuring that you are touching the teeth, ensuring that you are not just passing like that, hurting your gum. You have your dental floss, the normal dental floss, okay, that it become a little bit complicated to use now, but you grab the dental floss in between your teeth, and then you can have it long for the back teeth and short for the front teeth. But also now you have flossers that is very easy to help the kids to use the flosser, ensuring that you make pressure, because the idea is not to floss the empty space. This is not to remove food. This is to clean the space where the brush cannot reach, okay? So we ensure that we make like a C shape, we clean it, we remove it, you rinse it, and you reuse it. It have a little dental pick that it have the round part, that is the one that is gonna be under, and this is more to remove food, and if you can remove the food by rinsing and flossing, better. If you have to use it, be careful what you use it, and use the picks that are designed to be used in your mouth, not the Chinese one that are designed to pick the food and put it in your mouth. Those are made of wood, those are made without quality, and those rest of hurt your gums and left rest of good in your mouth that is not good, okay? After brushing, I don't want to get details in how to brush, but I want to tell you, please do not rush when you brush. Brush from the back to the front. Place the brush in the last molar all the way in the back. Ensure gently that the brushes go with a little bit of pressure on your tooth, and then in short movement you brush forward. And then brush the front ones, then with the edge of the brush the inner part. My recommendation for the gentleman, please look at the scene, because otherwise your wife is going to be really mad. Choo, 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 choo. And then we brush also the inner part of the lower one, placing the brush, little movement, and going up. The way of brushing is also personal. Which toothpaste are you going to use is also personal. The dental hygienist, your dentist, can guide you in that sense. But in general, you use a toothpaste with fluoride that you like, because the idea is that you brush the 2 minutes. So you have to like what you're using. The brush medium, the brush dry and clean before you brush. And for kids, if you can avoid the toothpaste with a lot of flavor, I don't want to say brands, better. There are toothpaste for kids, follow the age. I'm going to say a positive brand because it's a good thing that I'm going to say about that brand. So I'm going to say Elmex for kids that have no flavor, and you have 0 to 2 to 4, 4 to 9. So the amount of the fluoride at the beginning is 0 because we don't want fluoride at that point. And then after they start to put the fluoride a little bit until they can go for a general toothpaste that you can share with the rest of your family. For a specific needs, like sometimes when we reach certain age, we have enamel that didn't build up properly, so we need a special fluoride, toothpaste with a special fluoride like Pronamel from Elmex, Pronamel from Sensodyne, or Pronamel for any other brand. But your dentist or your dental care provider will guide you the best. I want to insist, careful with the things that have too much abrasion, careful with the baking soda, careful with the toothpaste with whitening, careful with those, do not abuse with those things. Can be used, yes, but should be used properly. So I will suggest to use the guidance of the specialist and make questions and do not abuse of it. And if you really, really want to use a toothpaste with whitening, use it at night. Don't use it in the morning. Because of how the design is made, the toothpaste with whitening actually was not designed to be used during the day. And then you brush, and then you have a cup of coffee, and the enamel is open like this, and the stain come more, and then you have to use more, and you get in a circle that can hurt your teeth. Okay? The other thing that I have to add here is remember to brush your tongue and remember to rinse properly after you brush and after you. This is a question always that people ask. They say, I don't like to floss. Do I really need to floss? Yes. In adults, you reduce the decays in between teeth 30% just by flossing, okay? So yes, we need to floss. We can use flosser, we can use aqua flosser, we can use a regular floss. Do the system that you like, take your time, but floss once a day. So this is an example. The other tools that you can use when it's tricky, and you have a bridge, and you have orthodontics that the doctor will explain more, that you have braces, but do not skip this process. In order to prevent gingivitis, in order to prevent periodontal disease, in order to prevent real periodontal problems, flossing is a must, a real must. This is an example of the things. And another thing that comes to the office very often is the person that say, I don't, when I eat, something is irritating me. I cannot drink cold things because, and I just want to point it out at this point is that the structure of the tooth, the dentin, is not a sealed tissue. Imagine that you have tubes, little tubes of crystal, okay, they are kind of glued to each other. So anything that happens here is transmitted to the nerves that are inside of the tooth, and vice versa. If we have any problem here, it can also go to the tissues around the teeth. So this is also a reason why we should floss to ensure that we remove the plaque close to the gum when the brush cannot reach, and also it prevents tartar or something to build up. Sensitivity, when you have, there is many reasons that sensitivity can come, because we grind our teeth, because we clench our teeth, because we lost a little bit of bone and the gums recede. The dentist will guide you what is the best option for you. Sometimes it's just keep it clean and put a little bit of fluoride. Sometimes you have to put varnish. Sometimes you have to do fillings to prevent the hypersensitivity. But at the moment, it's not normal to have it, okay, unless you are eating an ice cream. But for the rest, if you have hypersensitivity when you brush or when you talk, please look for help. Please go to the dentist, do a checkup. It might be very simple solution, so don't wait until it's become a real problem. And in this case, in this question, what are the early signs of gum disease? When I have to be aware, when I have to be worried about it. In cavities, it's kind of more simple, because sometimes you have sensitivity when you eat something sweet, then you know that something is happening, or you can see it because you have a hole. Did I do something? Probably. But in gums, it's different. In gum, it's more complicated, because gums disease is silent. It's like high blood pressure. To give you the sign, sometimes it's kind of late, okay? So we have to really be careful. Gums are not red. Gums are not shiny. Gums are not smooth. Gums are a little bit rough, are opaque, and you are not supposed to have like a little lifesavers around your teeth. You are not supposed to have bulkiness around your teeth. So what happens is that you see your teeth, everything is okay, but inside, the problem is there. Inside, the tartar has gone lightly under the gum and stay there, because those bacteria have no head but are really clever. They are not going to be, they're colonized places where you cannot reach with a brush, so they live there happily ever after. You will feel the pain when it's kind of late. So we had, see? It's look okay. It's look like everything is supposed to be okay. I don't see a little bit red, no. But that is an early sign. You see it here, it's bulky and there is red. No, we are supposed to see our gums opaque and not shiny. And of course, if it's bleeding, it's not an early sign, actually. Oops, I think I went one forward. But it doesn't matter. The other one was actually to show you that the question was, is bleeding gums normal? No. People said, oh, come to the dentist, come to check up, and, or to do a cleaning. Say, careful, doctor, because I have bleeding gums. So you have to go gentle. Don't touch me here and there because my gums bleed. That is not normal. It's like you say, oh, careful, don't talk to me because I suffer of headaches. So you cannot have headaches 365 days if something is wrong, okay? So bleeding is a symptom. is something is happening, and of course you have to look to, for the guidance of your dental care provider to see what is hurting. Some is bleeding. Most of the time, 99% of the cases is a local injury. It's tartar, it's bacteria, it's that maybe the brush is too hard. It's something is maybe the mouth rinse that we are using is too harsh also too, or the toothpaste give you some irritation because you are allergic. It's very unusual that these last two ones. Most of the time it's tartar and bacteria plague that is there. But sometimes could be lack of vitamins, or even sometimes can be a sign of a serious disease. So you have bleeding gum, make your appointment, go to your dentist, check what is going on, and you're going to be guided to look for a solution about that. The next question, does what I eat affect my teeth? Yeah, affected a lot, okay? And what we snack too, and what we send our kids to the school as lunch too. If you're gonna send a cookies, it's better an oatmeal cookie than a chocolate cookie. So it's not that we are not gonna eat sweets never in our life again, but if we control when we do it, it's much better. And if you're gonna give cookies to the kids, do it at home. Give it 3 of them, and then after rinse or brush. Instead of one cookie now, one cookie in half an hour, one cookie in 2 hours. Because after each snack, even the healthier one, you're gonna have a acid attack. 10 minutes after whatever we eat, even the most healthier apple, we are gonna have an acid attack. And that acid attack is gonna affect the enamel, and then the bacteria are gonna have the enamel is gonna make a space to the bacteria to live, and when you brush, you are not gonna be able to brush it properly. So what we eat, we have to be careful about that. Another thing is like sparkling water. Do not abuse with the sparkling water. If you eat with while you are eating, that you're gonna produce a lot of saliva, no problem. But do not use sparkling waters as a regular water to eat during the whole day, because they have carbonate. They have no sugar, but they have carbonate that is acid that also can hurt your gums, your teeth, the enamel. The enamel is very strong, it's very hard, but also it's not a sealed tissue, and it can be affected for acid things. So we have to avoid also acid things. Rinse often. I cannot brush, rinse. I cannot brush, drink water. You're gonna eat a cookie, eat it with water instead of a cookie and a Coca-Cola, instead of a cookie and a juice. Something sweet with a drink that is gonna help you to clean and produce saliva, better than something that is also sweet. And drink enough water. It's not 2 liters in the morning when I wake up, no, a little bit of water during the day. And ensure to provide the kids the water, because most of the kids, when they ask you for water, is because they are really, really dehydrated. So we have to offer the kids water, especially the tiny ones. Oops. This is an example that what we eat can affect us. This is when we prolong the breastfeeding to the kid, because natural breastfeeding also can produce this. This is a decay caused by the milk, with or without sugar. When you put sugar to the kids, even worse. But this is something that we know why it happens, and we still see it all the time at the office. And the pain and the sore and the trauma that the kids had during this process, because they can have really bad abscess, is really have no sense. It's better that the kid cry a little bit, because you are not gonna give her the milk like that, because it's a habit that actually we create. Then he cries later because he has an infection and you have to give her antibiotic, etc., etc. So that bottle, no, that bottle, drink the bottle, finito, clean the mouth of the kid. If they have no teeth, with a gauze, they sell in the pharmacy finger covers, cloths, and silicones, and so that you clean the mouth of the baby. Please clean the mouth of the babies in the first feeding because they get used to be clean. If you don't clean the mouth of the baby, then when the baby is 2 years old and you come with a brush, the baby is going to run away. Okay, you have to teach them the habit since he was in your belly, okay, since the beginning. So careful with this. Be very aware of that. Even if it's breastfeeding, that the moms that sleep with the baby and breastfeeding during the whole night, that can also affect badly your baby's teeth. The mouth is not out of, this is a very good question that people ask always at the office. People do not recognize that you may be spending thousands of millions of dollars taking medication for a specific, especially for high blood pressure, kidneys problems, sometimes even thyroid problems, and the mouth is gone. And they have tartar, they have periodontal disease, they have abscess. So all those bacteria goes through the blood from the vessels that are around the tooth and go wherever they want, from your brain to your kidneys. It is related, studies related that in between periodontal disease and babies that are born before time. Babies that are born with not well developed in weight. So I'm not going to go in detail for that because it's a long story, but it is important. So my awareness is that the mouth is part of your body, and whatever is happening in your mouth, it will affect your whole body, okay? And it's related. It's not that because I have diabetes, I'm going to have periodontal disease, that how we believe for like 30 years. No, it's the opposite. The periodontal disease is a factor that you're going to develop a diabetes type 2, okay? So to prevent diabetes, please prevent periodontal disease. To prevent high blood pressure, please prevent periodontal disease. To prevent that your baby is born before time and it can affect your baby, please check your mouth before you even get pregnant if it's possible. But immediately you know that you are pregnant, please check with your dentist, please check with your mouth hygienist. And then we go to tips. Happens sometimes that you know a friend or something that have bad breath and you are not capable to say, oops, Juan had bad breath, because not even your best friend is going to tell you, okay? Nobody. So tips not to have bad breath, of course, is going to do your regular checkup every 6 months, that like I've been saying. If you have also tobacco or any problem like in your sinus, in your stomach, please check with your PG or your specialist. It is true. But 90% of the cases is coming from your mouth. Brush properly, clean your tongue, drink enough water, keep your mouth hydrated. If your mouth becomes dry, there are special mouth rinses that your dental care provider can guide you into that help you to produce more saliva to help you with that. And especially do your regular cleanings. Every 6 months you're cleaning, so you will have much better approach, and then your breath is going to be fresh. This is the thing, and I'm not going to touch the topic of thumbs sucking or pacifiers or all those habits that can affect the way we bite and how the way we bite affect other areas, because we have the specialist orthodontist here that is going to do that. But I want to just touch what it is to cleanse our teeth or to grind our teeth. I am a bruxism. It's related with stress. It's a neurological disease. It's not because of your teeth. That is a consequence. Sometimes can start because we have a high contact because a filling was not properly done, or our teeth didn't grow in a right position. And it's a habit that can become a problem, but also can be related with stress, tension, that then make some tension in certain muscles in our neck and face, and then we finish grinding our teeth. Doesn't hurt. At the beginning, people will say, "Oh, nice, you have your teeth straight. They look beautiful." No, that is not normal. Okay, the teeth are created to do what it's supposed to do. So there are ones that are longer, there are ones that are sharpy, there are ones that are less so. So it's not normal. So please also, if you wake up in the morning with tension in your muscle, or you see that you are clenching your teeth, or your partner in life is telling you you're doing noises, check your dentist. They can create, prepare for you appliance to protect you. They can guide you. Work together with the physiotherapist. For sometimes you need physiotherapy for that. It's a multifactorial thing. They can be addressed. And this problem, you don't need to reach this level, but this problem of bruxism also can give you problems in your joint, pain, but also can kill the tooth, and you might need a root canal and a crown for a tooth that have no decay. So it is a real problem, so please also don't leave it like it's normal, because it's not. So we have to address that, and in the earlier time, in the early stage that we address it, much better. Are whitening products safe for my teeth? Is a very common question. I think I answered this question, I don't know, maybe 2 times a day. Yes and no. As long as we use it thinking and with care, yes, they are safe. You can use the home system, you can use the toothpaste, you can use rinse, follow the instruction, ask questions, search about it, ask your dentist, ask your dental hygienist. Do not abuse. If I bleach my teeth, but I smoke, and I pretend to have white, super white teeth like this wall, but do not stop smoking, forget about it. Don't do that, because you're going to damage your teeth. Okay, you have to decide which one is more important for you. You can use toothpaste with fluoride, with light whitening, to prevent that the smoke stain doesn't go so bad in your teeth, but not do a strong whitening system, and not doing for prolonged period of time, because otherwise it can affect your enamel, can affect your teeth, and you can have a real problem. But in general, yes, do not overuse, do not abuse. Use the guidance of the professional, and everything should be okay. Okay? In general, this is what I brought for you to present today about awareness. If I have to let you with some final quote, is that anything that you feel in your mouth, please go and check. That the mouth also can be a window to prevent serious disease like leukemia, cancer, and other problems. That is not normal to have an irritation area in our mouth. That is not normal to have a part of our gums that hurts. That is not normal that we have a ulcer or something in our mouth that doesn't heal by itself. You can hurt your gum a little bit, and then hours, even 1 day after, should be okay. Anything beyond that, make your appointment, check. It's better that they tell you, no, it's nothing, it's just an inflammatory process that is going to heal in a couple of days, let's do this gel or something like that. And it's not to have something for 2-3 years, and then when we go, and it is late. Preventive measurement start, and good habit for the kids start at home. The kids will learn to brush when we are 2 years old. We cannot brush our adult teeth with the same amount of time and the same way that we will have baby teeth. Doesn't matter how smart your kid is. Motricity, fine motricity, is not developed at 4 years old. It's not developed at 6 years old. Brush has to be supervised until 8. At 8 years old, floss should be introduced, at least. But it's introduced with, now you have flosser, you actually can introduce it with baby teeth. Okay, so these have to be introduced so they don't have the problem that we have, that we don't remember to floss. Okay, and floss is important every day. But 12 years old, the kids should floss once a day. Okay, because by 12 years old, more or less, they have all the permanent teeth out, and your checkup every 6 months. And this is a quote that we have in our office. And I think it's one of the more real things that we can say as a dentist to you. You don't have to brush every day. I have a loan to pay, so don't brush. Don't go every 6 months. For us, it's more convenient, economically talking, if you have a big problem. We had patients that said, no, I don't go every 6 months because if you want me to give you money. No. If you go every 6 months to do your checkup, and if in the future probably it's going to be part of SBB, so you will not spend money in the dentist unnecessarily. So it's going to be better for you. Smile, enjoy your life, have the mouth that you deserve, have the happy teeth that you deserve. In the meantime, if they are not 100%, doesn't matter. It can come. If something can be done, but do not neglect your mouth until it's the perfect one. No, fall in love with your teeth the way they are now, and take good care of them like they were perfect, because each one of them have a value. If you have to substitute the teeth, it's expensive, and also it is part of you that can create problems if we don't take good care of them. So take good care, keep all your teeth, smile a lot, and have fun every day when you brush. For the gentleman, I have to make a little quote that I didn't say while they're brushing. Please brush in front of the mirror. Don't brush when you are taking a shower. Gentlemen have the tendency to bring the brush to the shower. I'm done. No. Put yourself in front of the mirror and brush, taking care. Think that you are doing. Think that you are brushing. Feel that your mouth is clean. Rinse very well and make, perfect. I'm ready to start my day. Ready to go to bed. Alone or together, doesn't matter. Brush like you are with for me, Brad Pitt. Beside, and have your smile that you deserve, and the teeth, fit you. Okay?
We're going to take a couple of questions before we take a break. Any questions for Dr. Ina?
One question, please, at least once. Okay. Yep.
We are a lot more proactive with the kids.
Can I lend you? Come, help me. Yeah. Kids doesn't matter. Have nothing to be with the age. Have nothing to be with how smart it is. Okay, they can know all the countries of the world. They don't have it. So it's recommended the baby, then you brush him. Your pediatrician, your dental hygienist, your dentist. While you are pregnant, BCI have a program also to teach pregnant women how to brush the teeth of the baby. So use it. And the internet, there is everything. Okay? And when he's a little bit, well, I'm short, no? But the idea is you take the hands of you give the baby the teeth, the brush, you hold with this finger, this hand here, so he's gonna allow me to guide him, okay? It's like when we used to learn how to write cursive, but the kids doesn't learn how to write cursive anymore. So they don't learn how to brush. I used to use those examples, but I'm old, okay? So we guide the teeth, like she said perfectly. And then it's not that you have to do it every single brushing, but at least once a day, and then you will guide, you will see and check with your kids. If he's improving, then I give him more space, and until I just check that everything is okay. Thank you.
Because in case if a child has a starting cavity, as a parent, you could see it sooner than as opposed to when it gets too late.
Yeah, absolutely.
Because
and
you
also,
do not want a child to come and complain
No.
of pain, because then it can be very traumatic for some.
It's actually a good help because it's a daily checkup. So you got it like this. And a certain food are really sticky on the baby teeth. And especially the transition in between permanent teeth, just baby teeth and some permanent teeth. Remember, the first molar come out when we are 5.5 years old. Okay, so the big molar in the back are permanent. They are not gonna change those, so they have to be brushed by an adult. Totally agree. And I have that issue. You might have it too. No, he can brush by himself because she's super smart. Have nothing to be. With the girls, it's easy because I tell them, when she can do the hair by herself, those beautiful things, what is the name? When she can do that by herself, then I shut up my mouth. Okay? But before that, no, it's a matter of growing. Fine motricity have their time. Okay, that we are human and we learn that a little bit later. So yes, it's really, really, thank you, really, really important. Supervise, actually in my form, 100% of them, my suggestion was supervised brushing, supervised brushing, supervised brushing. The kids, they are not used to that, they start to fight, they don't want to do it. Yep. They go around, it's a nightmare. We are the adults. You cannot do what they say. You have to do what is good for them. Okay? Yeah. Thank you. Thank you.
If not, we want to ask let's give Dr. Hilda a round of applause.
Sorry, was a longer than I was expecting, but it was needed.
Tell everybody.
We want to say, we want to excuse
See you, thank you.
Minister Council as well that is leading at this point of time. Thank you for coming, and we will for more governmental properties further.
Good afternoon. Good afternoon. It's okay? Good afternoon. Hello? Start. Yes. Good afternoon, everyone. Thank you.
This is for the internet.
This is okay. Okay. So my name is Wissam El Hafi. I'm orthodontist in Colby. I'm a St. Martin since '99. So many of my patients now used to be 10 years old. Now they have their own families, kids running around. Some of the mothers still here, I think. It's important before any orthodontic presentation to have a dental presentation, because most of my patients are referred or by the dentist or by the hygienist. So you must visit the dentist to detect any kind of problems in bone and teeth. Otherwise, now in St. Martin since 25 years already, most of my people knows me, so they come straight. This does not mean you can skip a dentist. Now, to talk about orthodontics, about topics, I must show you cases, pictures. Then we can talk about discrepancies and the way to treat discrepancies with devices. So you might not see me, you might hear me because I'm going to sit over there. I'm going to swing with my slides. Thank you. I have to. I have to use also some pictures so you can plug it to be easy for me. You can plug this one. Yeah, but I have to swing a little bit with others. Some topics. We are going to expose 5 to 6 topics. We cannot talk about everything, but there is a lot of things to talk about it. So I'm going to be brief to just show you some discrepancies that most of you see with the children at home. Mainly we are going to talk about the habits, thumb, finger, tongue, which we call it in orthodontics the open bite. This is what we see. Then the side cross bite when teeth are not touching on the sides or on the front. And then some, what we call it cross bite also, and some development of the bones, jaws, upper jaws and lower jaws. And I have to add 2 other topics by the end concerning what we see most often now since a couple of years with St. Martin, about ventilation, breathing, because we have a tight cooperation with the ENT department about this topic, this kind of discrepancies. We can start by the open bites. What's the open bite? Open bite is when not teeth are touching. Parents come often to me saying, "Doctor, my son, my daughter, they still sucking their thumb. Sucking the thumb, sucking the finger, sucking the lip, tongue thrust." All that lead to what we call an open bite. These are not touching anymore. Some open bites, they are light open bites, question of few millimeters, 4 to 5 millimeters. Some of them are more important than that. Okay, we have to treat the child with an open bite. We have to let these things touch. We have to help them stop sucking. Now, when we suck our thumb, when a child sucks his thumb, what's going to happen? The anterior area of the bone on the top is going to go forward and to the top. This is what creates an open bite. You can see that on the X-ray over there. These are moving forward and they are going to the top. These always follow the movement of the bone. So when this child is sucking his thumb, he is projecting his bone, the anterior part of the maxilla, to the front and for the top. So teeth are going to follow. This is what happens when teeth are to the front, to the top. So the question is not only position of teeth, it's the bone itself. For these reasons, we must treat a child when he's around 8, 9 years old, even if he have mixed dentition, baby and permanent. Because at this step, the bone is still soft. Whatever we do with the bone, we are going to get a good response for our action. Don't wait too much late, because slowly when they are growing, the bone is getting more compact and hard, and the results to get them will be also hard. And we cannot use always the same devices, which we use them at 8 or 9 years old. So we have to go to upper level of devices, and here is more work and more hard to get results. So in this kind of discrepancies, we have to help the child stop sucking the thumb. Most often, when we have a thumb suction, as I said, teeth are not touching anymore. So we can see on the sides there is construction of the bone. The bone is not anymore wide it's supposed to be due to the pressure of the thumb. So the bone became like a V, and the teeth are projected to the front. We have to help the child by stopping the suction. The best way to close an open bite is to eliminate any kind of solicitation. Solicitation mainly will be the thumb. So we have to help him to stop sucking the thumb. We can start by simple things, what we call simple things in orthodontics, that mean soft expanders. Soft expander is just small bands on the back and small device inside. This kind of expander, we call it, it helps to give a shape again to the upper jaw, make it more wide by activating the system. Because when we suck our thumb, we are making the constriction of the bone. Like that, the bone material is projected to the front and to the top. So we have to give this bone material again its shape by widening the upper jaw. This is one. Second, by putting a device like that, the child have tendency to put his thumb. When he put his thumb, he is touching this area. You can follow my arrow, the arrow here. So when he's going to put his thumb with the device, he's going to hit the metal. It's not going to be anymore the same sensation. So most of children around 7, 8, or 9 years old, they give up by themselves, sucking the thumb after putting such simple device. Then, by giving up with the suction, we are giving the way for the bone to help herself to restore the position supposed to have in the beginning. That means eliminating the solicitation, we are giving the chance for the bone to go back again to the position supposed to be. Like that, the bone by itself, without the braces, you can see after just a expansion, most of the open bite is closed, just due to a simple expansion. Then with braces, we can come and finish completely, so just taken after removing braces, finish the bite in the front. Now, some kids doesn't want to stop really. At the same time, some open bites are hard. They are bigger than 4 or 5 millimeters. And here we are talking about maybe 10 millimeters. In this case, the expansion by itself, because you can see on the side, the bone is in constriction. So it needs expansion. But even with expansion, we still have an open bite. For a simple reason, the open bite is too much big. Even if the child stops sucking his thumb, we have another problem. When you have a big open bite, the child has to swallow. And to swallow, there is a big opening in the front. So, in order to swallow, he has an obligation to interpose his tongue between his teeth. So, here we have two factors, the thumb or the finger and the tongue. So, even if the child stops sucking, the tongue is taken over, and we still have an open bite due to the swallowing and suction of the tongue. So we have to help the child in another way, and instead of putting just a habit breaker, we have to go further by putting a habit breaker, expander habit breaker. A habit breaker is not always nice to have it, because it's the expander itself with a piece of metal in the front in order to close this open bite there. It will help in two things. If the child is insisting sucking a thumb, the thumb will be hitting there, so he cannot really suck. And another side too, the tongue will be staying behind this piece of metal. So no interference of tongue is going to interfere in the front. And here with braces and with elimination of solicitation, we are helping the bone to go down by itself, and with the push of braces to close these kind of open bites. So expansion by itself or just a simple expander is not enough. We have to help the child by putting in a habit breaker to break that habit. And here, this kind of situation doesn't happen from day to another. It takes time to close open bites. Normally open bites, we can never close it exactly, not less than 3 to 6 months. It depends on how the cooperation of the child is same time. Then braces will come here to perfect the bite and closing perfectly the open bite. But the main thing, again, I reminded that we have to eliminate all kind of solicitation, suction or tongue thrust. Some open bites, if we don't interfere early, well, this is an extreme case, so I would like to show it to you. And here a patient that at the time we used to have 7 years old. Closing such open bite, it took a good 9 months. So as we see, there is constriction of the upper jaws, the lower as well, sure, and the position of tongue, the lower teeth getting down because the tongue and the finger is there, so the finger is pushing up those one and pushing down the others. This is the science. The solution was to start with a habit breaker from the beginning. And it took a good 6 to 9 months slowly to close such open bite. And after the braces were here with some elastic sure to get what we are looking for. So don't hesitate to bring your child early to an orthodontist to avoid having more serious problem later. Because now this child is around 7, 8, 9 years old. Again, the bone is soft. You can get the results we are looking for. Otherwise, 11, 12, 13 years old, the bone starts a little bit to get hard. 15, 16, it's already compact bone. We cannot act only with habit breakers or with just a soft expander to close open bites. 16 years old girl with open bite due to some suction. You can see still this constriction on the top, left and right. We still need to do the expansion because the upper jaw is narrow. I'm insisting always about the expansion because this is a result, the upper jaw is narrow as a result of suction. And we cannot have nice results if we don't give the bone again the shape it is supposed to have. These kind of expansion, 15, 16 years old, are not possible anymore with soft devices. The habit breaker at 15, 16 years old cannot get big results neither, because the habit is there already, the bone already is getting deformation. So we have to go to upper level of devices. Unfortunately, but it is like that. And these kind of expenses, expansions still possible, but we use devices a little bit now. Well, technology has given us a little bit more options now. Expansions devices by using many implants with the expanders. Those kind of expanders, we call them rapid expanders. Rapid expanders are supposed to give results in maximum couple of months for teenagers or sometimes adults around 19, 20. Now, actually, since a couple of years, we are using implants the same time with the rapid expander, and we are getting expansion quickly. When I mean quickly, we are talking about a couple of weeks. So these kind of expanders they come with implants. We put screws inside the upper bone in order to get fast results and sure results. And when you place them, well, we are perforating the bone over there. And every night, the patient at home or some of his parents going to activate the system. And like that, we can talk about good expansions here. Sometimes it's afraid, you see the upper jaw already is expanded, it's not a constriction anymore, left and right, and especially in the front I have a nice space. Some people are afraid from spaces in the beginning, but we are going to use the space to close the open bites. Because normally, when you close spaces, We are putting braces in the front, sure. And then we close the spaces and we push back teeth. This is a way to close open bites with a good expansions. So 15, 16, 17 years old, we are talking about different kind of devices, different kind of treatment, a little bit more difficult, but we still need expansions to have the patient closing this kind of open bites. Now, sure, this patient is not sucking a thumb anymore, but the damage is done already. So it was just to expose you a little bit the different type of devices we are using them concerning open bites. Habit breaker, we talk about habit breaker, soft expander, and rapid maxillary expander with braces as well. Now, the suction, the result of suction, as we talk about it, is not only open bites, and the sides of the jaw are not always in relation like that. It can help also, it can lead to somewhat, we call it a cross bite. That's mean some sections, the upper jaw became narrow, the bite are not totally in relationship up and down, left and right. You can see the upper jaw here is completely inside. We need to put it outside again. As I said again, this is what we call cross bite, lateral cross bite. Sometimes bones, ligament, muscles, the nature itself, it resists to any kind of suction, fortunately. But the result, the damage of the suction is still here by a cross bite on the side. And here we still have to use, again, expansions in order to correct this kind of cross bites. Expansions, again, same. We are using orsopalatal expanders like that. We just talked about it. But it helps at the same time, stop and sucking. Or as well, here we can see the results after expansion with soft expanders. Or as well, we can use rapid expanders. These are kind of cross bite on the sides when you see your child like that, and you can see here that there's not enough spaces for all teeth. We have a cross bite, teeth are inside, the upper inside the lower jaw. One side is good, the other side is inside. And here we can see at the same time that we don't have space for everything. So some of the upper jaw, narrow upper jaw can come from two things. Some suctions and oral breathing. I'm going to talk about oral breathing later. So this is the result, lack of space, narrow upper jaw again. And here we have to go again with rapid expanders. Those are conventional rapid expander without screws, without implants. And we are looking always to make the upper jaw more wide, correction of the crossbite, and at the same time making space for all these teeth on the top. So, better in case of suction or oral breathing is to treat a child when he is around 8, 9 years old, even with mixed dentition, in order to help the bone grow up more healthy. When we have upper jaw narrow, it's not only we have open bites sometimes, but remember that the upper jaw when it's narrow, that means we have constriction of the jaw. We have less space for teeth. Some teeth are still inside, so they are affecting the evolution of teeth. And here we can see sometimes that some teeth are growing left and right. because we don't have space, or due to the suction, or to oral ventilation. And this kind of, again, of situation, we have to go again about expansion of the upper jaw in order to get more space. So this kind of, the teeth are not here. It doesn't have space. The first approach sometimes is the dentist, and here he gives the alerts. You have to see the orthodontist, because normally when the parents, when take a look to the teeth, they are straight. They are okay. You don't need to see an orthodontist. And it happens that we are with the dentist, even if we have good hygiene sometimes, here we discover that some teeth still inside. And here we are talking again about dentist visit. And then same expansion we are talking about in order to get more space and make space for those teeth in order to put them again where it's supposed to be. We talk about habits. 2 more minutes? Okay, I'm going to be brief. The last 3 topics I'm going to talk about it is the underdevelopment of the lower jaw. Sometimes we see our children, the jaw is to the back due to a lack of growth of the lower jaw. Not only braces have to be applied over there, but we are talking here about 9 devices in order to push forward the lower jaw. These 9 devices will help to get better connection with teeth and to avoid more serious problems later. And they have to be applied as well, maximum until 13 years old, because here we are getting directly on the growth of the bone. So 9 devices come after braces. It cannot replace really braces. Here what we can see, the big changement on the x-rays between the position of lower jaw and the new position of the. This is what we call underdevelopment of lower jaw. There is also overdevelopment of lower jaw or underdevelopment of the upper one. And here it's something completely different. Could be in same time just related to teeth. With simple braces, we can make correction and avoid that what is functional became basically constitutional later. Some crossbite in the front can affect the gum. Hygiene, position of gum, recession of gum due to an underbite. Putting teeth in position again with braces or other devices will help to protect the teeth to avoid more version from version and to help not to have recession of gums. Recession of gums, that means losing bone same time, coverage of bone. The last topic I want to talk about it is concerning the breathing, the oral ventilation. You have to watch your child, see how he is breathing. We must breathe with our nose. The roof of the mouth is the floor of the nose. If we don't breathe well with our nose, we can assist or we can have those kind of narrow upper jaw. If we have tonsils as well, if we have nose adenoid as well, when we cannot breathe with our nose, we are breathing with our mouth, the upper jaw become narrow. And this is reflect later on the way of growing. Recently, since a couple of years, we are working tightly with the ENT department in the hospital, and we did introduce some devices. We use it in Netherlands, in Europe, to help what we call the sleep apnea device. Now, many causes are for sleep apnea device besides obesity. We have to see a little bit how we breathe, because if we are breathing good by our nose, the sleep apnea will be less, I think, present, because all is about how we breathe. If the upper jaw is wide, we can breathe well with our nose. Trust me, we can sleep better, we can grow up better, we can make sports. And sleep apnea, we're surprised with the ENT departments that they are not affecting old people, but all of our young people in St. Martin. So watch how our children are breathing. We have to avoid mouth breathing. And check with dentists, with orthodontists, and sometimes orthodontists send it to ENT in order to check concerning tonsils or nose, because the airflow have to still go inside very easy. Otherwise, problems will come later. I think we don't have any more time, no?
Thank you, Dr.
Okay.
Any questions for Wisdom?
I just want to know if he has a card so that I can contact him.
This is good. Yes. It's very easy. I'm upstairs, Banco de Caribe in Simpson Bay. Or if you visit your dentist, he will send you down by me. If you visit your dentist, he will send you to Al
The
Haj.
information is also on the brochure in the back. Thank you. Any other question for Dr. Wisdom? No? If that, before, we're not going to break, we're going to go immediately. I want to present a video clip that was given by the dental care clinic that is very informative for the children. It's a cartoon script that gives you a good indication on how not taking care of your teeth can cause a lot of problem. We're going to play the video, and then we will be coming to the closing. I will ask then Lion Lynette to do the vote of thanks. But before that, we will do the video clip. Give Dr. Wissam a round of applause.
Roll it right up. Jesus, dude, what happened to your head? I got filled in, bro. Dang, did you fight a bone or what now? I was just having a normal day, meeting up with my street like you usually do, letting the comments boom, and then he said, my barbecue sauce is loaded with chili. He spat me all over my head. I carried on like nothing happened and said to myself, 8 o'clock we'll clean it up. But guess what? The toothbrush from 8 o'clock never showed up, and the dental floss that comes right after also didn't show up. Meanwhile, this little microbe on my head started off this mutant, ate the sugar, peed acid on me, and that opened a little tiny hole. Oh my god, so actually he's the mineralizer, bro. That's exactly right. The next day, I was hitting up a cookie, jab right, and the same thing happens again. Revenge will be sweet, because I'm full of sugar. Sugar all over my mouth. I said to myself, what's wrong with all these people? Dang! But I had no clue that that microbe was calling all of his friends like, hey, you guys should come over. This guy is full of sugar here. There's food for everyone. All the bacteria comes in and slowly forms a heavy, very acidic plaque that opens the hole a lot more. Wow, and where were a toothbrush and dental floss at this point? I had no idea, brother. But when the bacteria had a big enough hole, they decided to set up a cheap Airbnb, and then the real open hole business started, my friend. That's gross. Then one day I come across the whole peanut. He looks at me and says, don't even try it, man, I'm stronger than you are. And I said to myself, what the heck? It's insulin, did it? I was sure at first that I will. It was deep down to the hole. Excruciating pain, I went down. And then nothing. I had to go to the dentist. They drove me down, cleaned me up, Here we go again. Who did it?
Lion Minette.
Our Hygiene, Awareness, and Dental Care Initiative project of the St. Martin Lions Club has come to an end. But before that, we would like to thank our distinguished guests, our honored parents for being here, and also your fellow Lions. As we conclude this impactful journey of our Oral Hygiene Awareness and Dental Care Initiative project, it is both an honor and a privilege to extend our deepest gratitude to all of those who individually contributed and made this project a rounding sound of a success. First and foremost, we express our heartfelt appreciation to our Lion President. Lion President, Latine Clark, for championing this initiative as her signature project. Her leadership and her unawareness dedication to our community health have inspired us all and driven this project forward with a purpose and passion. We sincerely grateful to the government of St. Martin for their support and approval of this initiative. We thank the Honorable Minister Reginald Burke, Minister of Public Health and Social Department and Labor, our Honorable Minister Melissa Digons, Minister of Education, Culture, Youth and Sport, for endorsing this project. Our thanks is also extended for the 5 participating schools for their involvement in enriching this project. The Sister Regina School, are you here this afternoon? Reverend John A. Gomes Campus, Asher Stephen Hillside Christian School, and the Lionel Connor Primary School. A heartfelt thank you also goes out to our sponsor, the Motor World and Thrifty Car Rental, providing transportation for the students. Talent Group for printing the information booklet this afternoon. We also want to thank our dedicated Lion drivers to ensure the safe and timely transportation of our children to this center. Lion Claudius Van Camper, Lion Davy Woods, Lion Alphonse Gomes, Lion Kanda Joseph, and Lion Karen Lee. The Lions for assisting at the clinic, Lion Elton Richardson, Lion Wally Haverton, Lion Cameron, Lion Alphonse Gomes, and also our coordinator, Lion Eldert. Yes, let's give him a round of applause. Also, we'd like to thank our dental professionals for their service. Marlon Harley Clinic, Dental Clinic, Dr. Hilda Kevana and Dr. Marlon Harley. Brighton Dental Clinic, Dr. Leonie Bryson. We hope she feels much better. We wish her to be better. The Dental Clinic of Dr. Cassandra Dowling and Angelique Bentley Penninghoff. And a special thanks to our workshop presenters today for your presentation, Dr. Elena, and our orthodontist. He was my daughter. Orthodontist. We're so happy. Lion Michelle Smith, and also Lion Brody, Boyran, Lion Felix Richards, and Anthony Tyler, and our Lion President. Please give them a round of applause for their work, their tireless work and effort in planning this project and making sure that it's a success. Finally, we also thank our club and members for supporting this project and being there, helping our president to execute her project this year. Your spirit and service implements the true meaning of our mission. Together, we have made this meaningful difference in the lives of our children, advanced the importance of all-around health awareness to our community. Thank you all, and may we continue to serve with pride and purpose, and we challenge our incoming president to make sure that this project will continue next year. So, Alvin, you have some big shoes to fill next term. But this is something we have to continue because we see the results. It's something we have to continue with in the next year. Thank you all.